The privatisation of the NHS has been a lengthy and well-documented process, which started during Thatcher's Conservative government in the 1980s. It shifted the responsibility for long-term care of the elderly and the vulnerable from the NHS to local authorities and allowed hotel-type charges for long-term care. This violated a key NHS principle that patients should not pay health charges. Charges became means-tested and homes had to be sold to pay for the bills. Local authorities were forced to pass their responsibility for healthcare to outsourced private companies. This created a for-profit industry worth £6 billion a year. 90% of nursing bed homes are now operated on a for-profit basis. Almost 400,000 elderly patients are now a source of income in an increasingly privatised sector. The staff in these nursing homes have an increasingly casualised and de-skilled workforce. Privatisation of care for the elderly has created such a mess, we're still trying to sort this out 40 years later. This is the shameful legacy of privatisation in one sector of healthcare. And we can see clearly that the process of privatising the NHS itself will follow the same pattern. It will be run by private contractors who deprofessionalise and casualise the temporary workforce. There has been a creeping privatisation of the NHS. In 2012, an act was passed that, amongst other things, required all NHS contracts to be tendered to any qualified provider. So now we have ambulance services run by taxi firms. Private companies have taken over GP practices covering 500,000 patients in London, and a private company took an NHS hospital and cancelled the contract when there was no more money to be made. I have seen firsthand, working for Unite, organising in the health sector, outsourced workers, the damage privatisation does to our essential care services. If this tale of incompetence wasn't enough, the government is pushing through a new reorganisation. This time to establish what they call integrated care, which does the complete opposite, butchering our NHS into 42 separate areas. It should not be called integrated care, but disintegrated care. Each area has a fixed budget which cannot be overspent. This will create a postcode lottery and force each area not to cooperate with each other to save cash. Each area board will allow private healthcare companies to make decisions about the provision of healthcare. Again, another play on words. These companies are mostly private health insurance companies. So here we go again. The government's answer to underfunding our NHS is to let private companies run it. History has taught us that this is not the solution. NHS staff employed by 42 different organisations face a most uncertain future. Casualisation, de-skilling and the introduction of poor terms and conditions. The people of England face a regional, not a national health system, which will have different terms and conditions for its workforce and different provision of treatment. Chaotic, wasteful and irresponsible. Every government of the day has been entrusted to preserve and protect one of the country's greatest achievements, to cherish, not cherry-pick, and harvest off to the private sector. I urge the Minister to listen to the calls of my constituents, campaigners and trade unions and scrap the catastrophic health and care bill which destabilises, fractures and imperils our NHS. Thank you.